here, registered physiotherapist. Today I'd like to talk to you about the importance of directional preference in treating various musculoskeletal conditions. So one of the things that I really emphasize with my patients is trying to empower them to do exercises for themselves at home and to have an idea of what specific positions or movements or exercises or activities to do when they feel a specific pain. So essentially that they can treat themselves in much more of an empowering, active approach as opposed to passively, where they're just coming into the clinic, maybe we're doing some soft tissue work, maybe we're using some different modalities. Not that there's not a place for that, but that when they leave, they're able to improve upon whatever has been done passively, right? And so one of the key aspects in this is directional preferences. And sort of what I mean by that is in terms of, and this is a big component of what we do during an assessment as a physiotherapist, is to determine, okay, well, what positions, what activities make your symptoms worse, and what positions, what activities make them better. And basically what I'm trying to do in this case is I'm trying to figure out what directional preferences again sort of become sensitive or make their pain worse, and what positions desensitize their symptoms. And so this is a McKenzie sort of approach or technique in terms of exercise prescription. So for example, and this can apply to essentially any area of the body. We'll take the lower back to begin with. So when I'm asking somebody about, okay, well, what positions, what movements makes their lower back pain worse, really what I'm looking for is what specific direction, if we repeat this, is going to increase the pain, and what specific position is going to make them better. The other things I'm looking for as well are centralization of symptoms versus peripheralization. So in a lot of cases, and again, this goes for various joints, is when we repeat a specific movement, the pain might actually start moving away from the area, the area of where there's a problem, versus going towards it. So in lower back cases, in a lot of ways, if we repeat, let's say, flexion, in a lot of cases the pain will travel further down the leg. When we repeat extension, for example, the symptoms might then move up towards the lower back. Also, what I'm looking for is, if I'm repeating a specific position, what happens to the mobility? What happens to the range of motion? So again, going back to the lower back example, if I'm repeating, let's say, flexion forward, or I'm biasing that, what happens to the overall mobility in the back after biasing that for a period of time, versus if I repeat or go into an extension direction, what then happens to my movement after that? Same with, let's say, the shoulder. If I'm repeating extensions in a particular position, how does that influence the rest of the mobility in through the shoulder? You can look at that at every single joint. With the wrist, if I'm repeating, if I'm biasing a particular position, what happens to the rest? What happens to the pain? Does the pain go up? Does it go down? Does the mobility improve? How is the joint from a functional or strength perspective after repeating or doing a directional preference? So again, looking at the shoulder, if I, let's say, for example, repeat extensions back, which will in a lot of cases bias opening the shoulder joint and will give a bit of a stretch as well to the anterior capsule of the shoulder. It will also desensitize in a lot of cases the shoulder. What happens then if I resist abduction? Am I able to generate more of a force? So again, this is all the different sort of questions that I want to ask myself when looking at designing a very specific exercise program for a patient coming in. That's also why it's so important to have a thorough assessment, right? And to make sure and to have an idea, again, of what's making symptoms better and what's making symptoms worse, and to basically bias the directions and bias the positions that are improving function, improving mobility, improving strength, centralizing pain. Thanks again for watching, and again, please make sure that this is appropriate for you by speaking with a physiotherapist, and have a great day. Thanks again.